Very good evening, friends. Meeting again in the session of Stuart Close Philosophy, and we're discussing since long time the homeopathic posology. A very big chapter written by Stuart Close in order to explain the concepts of posology, the drug or doctrine of dosage. And the concepts are thoroughly explained by him. Most difficult part in homeopathy is to select the right potency. What Stuart Close has said is very clear that selection of a remedy is quite simple, but selection of a potency is quite difficult because things are rather dynamic in homeopathy. And when you consider the remedy for the dynamic human being, the dynamic remedy, it always depends upon the judgment. It never depends upon the fixed rules of allopathy. There is no question of materialism. There is no question of selecting a medicine 5 milligram per kilogram of body weight. It's not like that. Here you have to judge every point. You have to find it out what is the susceptibility of the patient, the first important factor which he has mentioned. The second important factor which he mentions, nature of the disease, whether it is acute or chronic. Then seat of disease, where exactly it has been placed. Then it depends upon what is the miasmatic background of the patient. That also you have to take into consideration. Then you have to take into consideration the constitution of the patient. And lastly, even what medicine you are giving, that also matters a lot. So there are many factors which you have to take into consideration while selecting the remedy, while selecting the potency. And at the same time, he has given long explanation when to repeat and when not to repeat. That is also another thing which he has highlighted and that we have discussed in earlier lecture, that when to stop and when to repeat and how much time one should repeat, that also we have finished. So these are the things which we have finished up till now, that is the selection of the dose and repetition of the dose. And now the third important point which he mentions over there is the effect of the remedy. It is as good as what happens after giving the potency, what you have to observe, what effect it has produced. And that is nothing but the remedy reaction which you have to observe. And this also Stuart Close has made thoroughly, he has tried to explain thoroughly over there. So open your book, the 205 page number, the Homeopathic Posology, Stuart Close, effect of a remedy. The next point to be considered under general subject of homeopathic posology is the effect of the remedy. After we have selected what we believe to be indicated remedy and administered it in a proper potency and dosage, it is our duty to observe the patient carefully in order that we may correctly note and intelligently interpret the changes that occur. Very important part of it is that we must correctly note what is going on and intelligently interpret the changes. This is too important. Whenever you are doing homeopathic practice, it is not a matter of just a practice, it is a matter of using intellect and logic every time. Without intellect, nothing is possible because ultimately everything is dependent upon that. So whenever you observe or you are going to observe the patient after giving the medicine, then definitely you have to look for what are the changes and you have to intellectually interpret the changes. For upon the changes in patient's condition as revealed by the symptoms, depend our subsequent action in further treatment of the case. So when patient returns after first prescription and what are the changes which happens to be there or which you observe over there, that you have to look for. You have to look for whether generalities have been improved, whether the patient generalities are decreasing but patient is feeling better. All things, all the pros and cons which you have to take into consideration. How is the patient at the general level, at the mental level, at the emotional level, at the physical level, at the particular level. Every point you have to take into consideration and then you have to understand whether your remedy is right or wrong. The first thing to be determined is whether the remedy has acted at all or not. First point, very important thing which he mentions over there is very correct. That is whether your remedy has acted or not at all acted. That is the first important thing. If it has not acted, we have next time to determine whether the failure is to act is due to the error of the selection of the remedy or to the selection of wrong potency of the remedy. So, first point, whether it has acted or not. If it has not acted, then again 2 points, whether your remedy selection is wrong or whether your potency selection is wrong. See how logically he has explained. This is the method one should go ahead so that you can come to the conclusion very easily. If in carefully reviewing our symptom record, we find the remedy rightly chosen, we change the potency to a higher or lower potency as circumstances may require after reconsideration of the patient's degree of susceptibility. So, if you have chosen right remedy, you have gone through all symptomatology, whole case, and you have find it out that your remedy is right, and still it is not working. If it is not working, then you have to find it out what is the susceptibility, whether there is any problem in judging the susceptibility, and accordingly either you have to go for higher potency or either you have to go for lower potency depending upon the situation. Situation matters, and accordingly the selection of the potency matters. Sometimes if you have given 1M and it is not working, you might have to come to low potency if the situation requires that. So, you have to look for all the pros and cons so that you can judge and find it out right answer to the case. So, first important thing which you have to observe is the whether your remedy has acted or not. If it has acted, if it has not acted, then you have to find it out. 2 points. First, whether remedy is selected is right or wrong, or whether your potency selection is right or wrong. In deciding the question whether remedy has acted or not, we must be careful not to be misled by the opinions or prejudices of the patients or his attendants. See, he make you warn that you should not just depend upon what patient says. There are some patients, they vaguely answers. They answers, yes doctor, little bit feeling better. Then you cannot get exactly whether your remedy is acting or not. They talks in a vague manner, and that creates a problem. So it is not just what patient says or attendant says it matters, but here your role plays very vital role. Some patients having all their interest and attention centered upon some particular symptom which they regard as all important will assert that there has been no change, that they are no better or even worse than they were before they took the remedy. So their thought is always behind that if they have specific point to be considered only during the treatment, then if there is no change in that symptom, they say yes, your remedy has not acted. They never takes into consideration rest of the things. It is your duty to go with over the case, ask one by one, how is this point, how is this second is, how much is you are in. And if rest of the all things are improved and that particular thing is not improved, it doesn't mean that remedy has not acted. Remedy has acted, but from patient's point of view, it has not acted. So these points which you have to take into consideration. These statements should be received with great caution, and we should proceed to go over the symptom record item by item with care. So, every point which you have to go through your case paper, the first consultation case paper, and every point you have to ask. We need not antagonize the patient by gruffly asserting that he must be mistaken, but may express our regret or sympathy and then quietly question him as to each particular symptom. So, you should not directly tell anything or express your emotions regarding the patient section. It is better to ask one by one. Ask him, yes, what is the change in that symptom? What is the change in over there? What is the change in your constipation? Every point you have to go for it. Will frequently find that the patient has really improved in many important respects, although his pet symptom Often constipation is as yet not changed or unchanged. And this happens many times. They are having fixed ideas. Some patients comes, they tells, doctor, it doesn't matter whether I feel better or not at all level, but just look towards my problem of constipation. That should be solved. Then I'm all right. There I will be all right. This is the way with which they talk. And this is what you have to concentrate, that don't concentrate only on one symptom, go through whole case one by one. The action of the remedy is shown by changes in the symptoms of the patient. So, second important point in which you have to look for, what are the changes which happens at the symptom level. So, action of the remedy is shown by changes in the symptoms of the patient. Upon the character of those changes depends our further course of action. A remedy shows its action, number one, by producing new symptoms, number two, by disappearance of the symptoms, number three, by the increase or aggravation of the symptoms, number four, by amelioration of the symptoms, and number five, by a change in order or direction of the symptoms. So, these are 5 points which you have to look for, other than whether remedy has acted or not. If it has acted, then in what way it has acted. Very important thing. So, 5 important points which Close has highlighted, one should not miss, and those are very, very essential points one has to look for. So, first point which he mentions over there is whether it has produced new symptoms. Second point is disappearance of the symptoms. Symptoms have been completely disappeared. Number three is aggravation of the symptoms. Number four is amelioration of the symptoms. And number five is change of direction or order of the symptoms. So these are 5 points. You must write it on your notebook, keep it over there, and every time go through that so that you get habit what to look and how to look for. If it is imbued or incarnated in your body, then you get that habit of asking or looking towards those things. Now he explains one by one. The first point, an improperly chosen remedy may change the condition of oversensitive patient by producing new symptoms not related to the disease and detrimental to his welfare. So it is nothing but called as medicinal aggravation. Medicinal aggravation happens whenever your remedy selection is wrong and you have given that in repeated doses and patient has started getting new symptoms which were not at all part of his original symptom. These are called as pathogenetic symptoms. Their appearance indicates that remedy is not curing the patient but merely making approving. Discontinuance and an antidote is demanded. It depends. If the aggravation is marked, if new symptoms are strong, you may have to antidote it. If they are not strong, you have to stop the remedy and the dose disappears by its own. That is the one thing. But your action is depend upon what happens exactly, and you have to judge whether it is homeopathic aggravation or second, or whether it is a medicinal aggravation. Sometimes it happens that there are new symptoms which are not totally new. Those are the symptoms which a patient has forgotten a way back. Those were older symptoms might have recurred. And if it is so, it indicates the action of the remedy is right. It is going in reverse order of appearance of the symptom. If it is so, then you don't have to change the remedy. You have to wait, give the placebo and look for the symptoms what are coming out. And if those are superficial, coming from center to periphery, then you have to keep wait and watch. That is very important thing which you have to look. So you should be cautious enough while going toward the thought that it is medicinal aggravation. Every time it is not medicinal aggravation. Many times it might be older symptoms which have been forgotten by the patients reappear. So first point, you have to look for exactly what are those symptoms. Number 2 point is disappearance of the symptom. A correctly chosen remedy given in too low or sometimes too high potency or too many doses may cause an aggravation of the existing symptoms so severe as to endanger the life of the patient, especially if the patient be a child or a sensitive person and if vital organ like the brain and or lungs be affected. Belladonna in third or sixth potency given in too frequent doses in case of meningitis, for example, may cause death from overaction. Whereas the 30th or 200 potency given in single dose or doses repeated only until some change of the symptoms is noted will speedily cure. Phosphorus third or sixth in pneumonia under similar condition may rapidly cause the death. The lower potencies of deeply acting medicines are dangerous in such cases in proportion to their similarity of the symptom. So, you should be very cautious while using the potency. You must have that knowledge. If similimum is perfect, you are damn sure about remedy. If the state is acute, if you go with low, it always hastens the disease process. So here you have to select potency which is large, which is high enough so that it contains very less material entity and in fact it is more dynamic and it is more similar. Higher the susceptibility, higher the similimum, higher the potency. And you don't have to repeat too much because susceptibility is already high. So things you have to look for properly so that you can understand exactly what is happening with the patient. So this is second point which he is highlighting over there, exactly what is happening with the patient that you have to look for. The more accurate the selection of the medicine, the greater must be care exercised not to injure patient by prescribing potency too low or doses too numerous. This is the caution which he has mentioned, and this is the big problem which many practitioners they never understand the question of posology. There are many practitioners I am seeing that they are using 6C, 3C and they are repeating. It creates problem. If you are damn sure your remedy is perfect, why to go for such low potency, which sometimes may hasten the progress of disease? Here, if you go for little bit high, 30, 200, 1M, definitely you will not require too much repetition, only few doses acts wonderfully in such types of cases. Close is very clear regarding his concepts of posology, and those, if you understand, then you will definitely learn a lot from him. Medication should be stopped on post appearance of such aggravations. So, if you know that aggravation has acted or remedy has acted and aggravation has taken place, it is your duty to stop it and give the placebo. An antidote should be administered if they do not speedily diminish. If aggravation is of severe character, antidote is necessary. The careless prescriber rarely recognizes such aggravation. The prescriber, if he is careless, then he will not find it out such types of aggravation. When he notices the symptoms, he usually attributes them to the natural course of the disease or calls it complication. So what he says is very correct. When he notices symptoms, he usually attributes them to the natural course of the disease or calls it complication. So sometimes if there is an aggravation and if he doesn't understand, he explains over there, this is the complication of your own disease. He never agrees this has happened because of medicine. So you must be able to find it out what exactly happened with the patient and why this is developing. You should be very, very cautious regarding all those things. Then he turns toward the third point. A slight aggravation or intensification of the symptoms appearing quickly after giving the remedy and soon passing away is a very good sign, called as homeopathic aggravation. It calls for a suspension of medication until the after following improvement ceases or the symptoms change again. It is the first and best evidence of the curative action of well-chosen remedy. So if you get that old symptoms of the patients, original symptoms of the patients gets aggravated after giving a medicine, it indicates your remedy has acted and now it is time to stop the remedy and give the placebo. Unless and until the reappearance of the symptoms comes. And this is what is called as homeopathic aggravation. That is third thing which you have to look for. The fourth point which he explains over there, a prolonged aggravation without amelioration and with progressive decline of the patient is sometimes seen in chronic deep-seated disease as a result of overaction of deeply acting antisoric or antisyphilitic medicine given in too high a potency in the beginning of treatment. And this is nothing but the Kent's first observation is there. It is called as killer's aggravation. It happens only because your patient's pathology is advanced and you have chosen a remedy and you have given it in a very high potency or in repeated doses. This is again a wrong thing you have done. If you do such a thing, it definitely aggravates the patient condition and patient leads towards the death very commonly. And that's why it is very specifically named as a killer's aggravation. So if you observe such types of observation, it is your duty to antidote it fast. If the potency is too high, its action may be too deep or far-reaching and its reaction too great for weakened vital force to carry on. Such remedies as sulfur, calcarea, mercury, arsenic, phosphorus given in 50 m or cm potencies have sometimes hastened tubercular or tertiary syphilis cases into grave. In the beginning, treatment of suspicious or possibly incurable cases, it is better to use medium potencies like 30 or 200 and go higher gradually, if necessary, as treatment progresses and the patient improves. So one should not go directly for the high potencies whenever the such pathological cases are there. If pathology is marked, then it is your duty. Just look for and observe and gradually starts with 30 or 200 and gradually increase if patient requires it. And this is the right way of applying the potency in specifically in pathological processes or pathological cases. So see, Close has trying to explain every concept clearly, and if you digest those concepts, then it becomes very easy for you to reach to the right potency. Very high potencies of closely similar remedy are merciless searchers out of hidden things. They will sometimes bring to the light a veritable avalanche of symptoms which overwhelms the weakened patient. The disease has gone too far for such radical probing. If disease has not gone so far, long or severe aggravation may fortunately be followed by slow improvement. And that patient was on the borderline and with the beginning of serious destructive changes in some vital organ. So that is second observation as per Kent's observation, that there is long continued aggravation followed by a slow gradual improvement of the patient. And this is another thing, if you have choose a high potency in a pathological case, but case has not advanced to such a level that it can lead directly to the death, there is aggravation, aggravation, aggravation and followed by a slight improvement and then gradual amelioration develop. It indicates that patient's pathology is not in an incurable state and it is taking recovery now. But again here the question of potency comes. You have chosen wrong potency. If you would have chosen little bit lower potency, it would have not produced such type of aggravation. In these homeopathic reactions and aggravations, we distinguish between changes occurring in the vital organs and changes superficial in the superficial tissues and non-vital organs. When old skin eruptions reappears, old ulcers breaks out again, old fistulae reopen, old discharges flow again, swollen tubercular gland becomes inflamed, breakdown and suppurate away, old joint pains return, the patient's heart, lung, kidney, liver, spleen and brain symptoms in meantime improving, then we know that both remedy and dose were right and a true cure is in progress. But if we find superficial symptoms disappearing and vital organs showing signs of advancing disease, we know we have failed. And this is the very, very important sign which you have to look for. If the superficial symptoms are disappearing and deeper structure, vital organs are getting involved, the order is wrong. It is going from less important organ to the more vital organ. It is going from periphery to inside. But if order is opposite, that vital organs are getting cured right from the brain, right from the heart, right from the lungs, and it is appearing on the surface in the skin, then order is very correct. Your remedy is very correct. So see, he is very in a simple language. He is explaining and explaining the things and explains that these directions matters a lot. So what is the action of the remedy? That is very important, which you have to look for regarding this. I think it's better to stop over here, and tomorrow we'll continue with the rest of the things. Most probably it is possible. It will require 2 more lectures to complete this chapter, but this is a big chapter which we have learned, and we have learned many concepts of posology in a simple language. So that's all for today. Today evening we're going to meet with the remaining part of the Kali group. I think we were discussing Kali group. The part of it is finished 15 days back. Today evening we'll revise the previous part as well as we'll finish the remaining part of the Kali group at 8:15. So thank you being there and good evening.
Thank you very much, sir.